The ongoing opioid epidemic is without question one of the most daunting challenges facing our nation, and has had a particularly devastating impact on Massachusetts. In Lowell, Massachusetts alone, there were 46 fatal opioid overdoses in 2015, and last week, the Middlesex District Attorney announced that there were more than 20 fatal drug overdoses over a 3-week period. These alarming numbers are made real by the many first-hand accounts of families who have bravely shared their stories about the devastating effects of heroin and prescription drug addiction as we search for a way to confront this crisis. And I have met with many of those families, and I appreciate the courage, the emotional courage it takes to bring those stories to me and to others, because it certainly does motivate us to understand the challenge we face. Combating this epidemic will entail the steadfast commitment of public officials across all levels of government. While some federal, state, and local efforts on this issue have begun to make an impact, and we're proud of what Massachusetts has recently done, we are only just beginning, and it is clear that a lot of work remains. We're fortunate to have a committed and knowledgeable partner in the Obama administration in our next speaker, Michael Botticelli, who serves as Director of National Drug Control Policy. Michael was sworn in last February 2015 after previously serving as Deputy Director and before that as Director of Substance Abuse Services within the Massachusetts Department of Public Health. I'm grateful that Michael has solicited input from these communities, most impacted by this epidemic. And earlier this year, he took time to meet with me and Sheriff Katuchin, who we heard earlier and we're proud to have with us today, to discuss its impact on Middlesex County and the school district. As his office works to prepare the 2016 National Drug Control Strategy, we are fortunate that he was able to join us today for this most important discussion. Please join me in welcoming Michael Botticelli.
Thank you, Congresswoman. Good morning, everybody. Despite how many years I've been out of Massachusetts, it always feels like home when I come back and meet with you all. I want to thank the Congresswoman and actually the entire Massachusetts delegation for their support for the work that our office is doing as it relates to the opioid epidemic and the leadership of many people in this room who continue. I know I sound biased coming from Massachusetts, but despite the magnitude of the issue here, Massachusetts continues to be an innovator in terms of some of the work that is happening, not only in Massachusetts, but around the country as it relates to the work that we're doing in terms of things like overdose prevention. I had the opportunity to spend some time with Sheriff Katuchin and hear about the program that they were operating both within their prison and as it relates to entry in terms of the work that we're doing. So these are models that we continue to promote nationally. So I want to talk a little bit about kind of what we're doing at the federal level and the opportunities that I see here. As Congresswoman talked about, we all know the magnitude of the opioid epidemic, not just in Massachusetts, but around the country. And I think that Massachusetts and New England, quite honestly, were impacted early by this epidemic. One, we had heroin use rates in Massachusetts and New England, long before the rest of the country did. And then, compound this with the prescription drug problem that we have here. We saw, I think we were impacted early on by this epidemic, and the rest of the nation, unfortunately, is catching up with us in terms of the impact here. I think and Congressman talked about the magnitude of the epidemic. We have about 47,000 people who died in 2014 of drug-related overdose. 28,000 of those were related to an opioid like a prescription drug or heroin. While we've seen a leveling off of prescription drug-related overdoses, Massachusetts is not alone in seeing a dramatic increase in heroin-associated overdose, and of late, fentanyl, illicit fentanyl, being mixed in with the heroin supply in terms of what we're seeing. If you track back from the early days of this epidemic, we can really track this to the vast number of prescribing prescription medication in the United States. So the CDC actually showed in 2013, we were prescribing enough pain medication to give every adult American their own bottle of pain pills. I'm very happy to see legislation just passed in Massachusetts that actually looked at restricting the number of pills that people are prescribed as a first-time defense, and also things like checking the prescription drug monitoring program each and every time. These are, I think, models for the rest of the country and where we've seen success in terms of the work that we're doing. So let me talk a little bit about kind of what we're trying to focus on at the federal level to do that. So, 2 weeks ago, we were, very happy that the president continues to use his voice and his political as it relates to do. Just 2 weeks ago, he attended the National Prescription Drug and Heroin Summit in Atlanta, hosted by Chairman Rogers, who has been a huge supporter of this work that we're doing, where we announced a number of public and private sector commitments in terms of the work that we're doing. One was, again, we followed some work that happened in Massachusetts, where we got commitments from 60 medical schools to train all of their residents prescribing as a condition of their graduation. We know that physicians and prescribers often get little to no training on safe and effective opioid prescribing. There was a General Accountability Office study that actually showed that veterinarians get more training on pain prescribing than physicians do in the United States. And so we know that we need to make sure that our medical professionals are trained. The Center for Disease Control also released their first ever prescribing guidelines for chronic pain. That they had basically 3 principles. That for people with non-cancer, non-terminal pain, opioids should not be the first-line therapy in terms of treating pain management. And then also, if we do prescribe, they should be the lowest possible amount and the lowest possible dosage. And then we need to closely monitor patients who are on these medications. So, we know that we need to really kind of ratchet back and have more judicious prescribing in the United States. The second piece that one of the other things that we heard, I heard this in Massachusetts, and I hear this around the country, the president also launched a task force to look at the implementation of the legislation that was passed a number of years ago in Congress that called for fair and equitable parity for private insurance companies to deal with mental health and substance use disorders. No matter where I go across the country, I hear from parents who talk about the fact that they try to access benefits particularly through their private insurance companies, and are often denied coverage or not given adequate care. So the president has convened a task force and wants a report by his desk by the end of October to see what more we can do at the federal level to make sure that parents who have, particularly parents who have benefits and people who have benefits are able to access them based on the law that Congress passed as it relates to parity. So, we also know that obviously resources are a big issue. And, one of the things that I think has been helpful is we have a tremendous amount of bipartisan support in Congress as it relates to the opioid epidemic, and we've been able to work with them in terms of looking at year-on-year increases to our budget. And by and large, those resources go out to our states and locals to deal with this epidemic. So in the 2016 budget that we just passed, there was a $400 million of dedicated funding to deal with the opioid epidemic. Excuse me, and that was a $100 million increase over FY15 budget. And the lion's share of that money will go to states who've been impacted by this to look at things like increasing access to treatment, particularly medication-assisted treatment, helping local law enforcement and others purchase naloxone. It's the first state in the country to have a police force equipped with naloxone, and also train family members to do that. And I have to say, we've been keeping up with the news. We now have law enforcement officers across the country who are now carrying and reversing overdoses through naloxone. If any of you know Lieutenant Patrick Lynn from the Quincy Police Department, he has been an incredible champion with police forces across the country in terms of sharing their experience in Quincy with reversing overdoses. He's really been a remarkable champion with law enforcement. We've seen law enforcement across the country take up that call for that. We are very pleased for the FY17 budget, despite everything we've done with healthcare reform, with Medicaid expansion, with parity. We still know that we have a huge gap between people who need treatment and people who get treatment in the United States. And even in Massachusetts, that has the lowest uninsurance rate in the nation, has a really good Medicaid benefit, really good program. I think, I'm sure you hear it all the time, that we have a real gap between the number of people who need treatment and the number of people who get it. And so for the FY17 budget, the president has proposed $1.1 billion in funding to expand treatment across the United States. And, we're really fortunate that Congressman Tsongas helps support that legislation and support that work, because I'm sure she hears, like we all hear, the need for treatment. The vast majority of that funding will go out to states. 920 million over 2 years will go out to all of the states to support expanding access to treatment. And having kind of led the system in Massachusetts for 9 years, I can't tell you how many times I heard, even again, despite healthcare reform, despite insurance rates, how many people did not have insurance, or how many people were not able to access care when they needed it. And so we need to continue to make sure that we are expanding access to treatment in the United States. So, I'll say this is probably the largest single investment in treatment in the United States. So there are a couple of things that I think, again, I always feel kind of somewhat kind of awkward asking people in Massachusetts to do things, because you, again, often lead the nation in terms of our response to this. But again, I think that there are opportunities that we all have to make sure that we are continuing to deal with this issue. And one of the things I think that has been incredibly important has been the partnerships that we've seen develop between public health and public safety, which has really been amazing. Not only have we seen law enforcement take on naloxone, where we've seen sheriffs who are implementing good treatment programs, but also looking at good reentry services for people who are coming out and partnering with our public health folks. Where we're also seeing places like Boston, Massachusetts, and Chief Campanella, who are looking at how do we help people get access to treatment, not arrest them, not incarcerate them, but really move them to good care and treatment. And, that program is being replicated all across the country. So, we can continue, I think, to work together, understanding that there's not one single solution. I think we also need to continue to focus on community-based take-back programs. I think many of you know, people often start using these medications, they get them free from friends and family, after someone gets them from a prescription. So continuing to participate in either DEA-funded take-back days or hosting community programs to be able to do that. We partnered with pharmacies to actually install disposal boxes. So anything that you can do on the local level to institutionalize drug take-back programs, I think becomes particularly important for us to do. So the next take-back date is April 30th. And the other piece that I think is really important, we at the district has a couple programs. We also fund through our office drug-free community programs. We have two in the 3rd district. These are grants that go out to local communities to support community-based prevention programs. They're called drug-free community programs. I would encourage all of you to look at that program, to look at how we continue to support good prevention, because we know that that's the place to start. That if we can keep young folks from using in the first place, that we'll be better off in terms of where we are, both economically and for the health and safety of our communities. So, it's really a pleasure to be here. Again, I really want to thank the Congresswoman and the entire Massachusetts delegation for their leadership and support, not only for the funding and the resources, but continuing to promote what we think are really good legislative solutions as it relates to dealing with this epidemic, not just for the Commonwealth of Massachusetts, but Sheriff Tuchin, who I gave a shout out earlier in terms of the work that he's doing here. But we continue to rely on you as some of the innovators across the country in terms of the work that we're doing. So we look forward to our partnership. I think I'm precluded from coming to Massachusetts any more times before I go other places in the country. But again, I really want to thank you for the work that you're doing, and not just because I was there. I love my job at the federal level. One of the things that I miss about Massachusetts is the collegiality that we have here, that everybody's working together toward a common goal. So I really want to thank you all for the extraordinary work that you're doing. Keep up the great work. Keep us posted on things that you need. Obviously, we'll continue to work with the Congresswoman in terms of making sure that our federal policy, our federal resources are supporting the good work and the good people of Massachusetts. So thank you very much.